Welcome. This is the week 2 of the module 3 first aid, and we're going to start off here with the first aid programs. Now, the first aid programs are to preserve life, to prevent injuries and illness from becoming worse, and also to promote recovery. So these are the 3 types of first aid programs that are crucial to first aiders. Let's look at the responsibility of first aiders. Well, when a first aider comes to someone's aid, they will accept and provide assistance safely. Remain on the scene until the casualty can be handed over to emergency staff or people that can help support him. And therefore, he must also realize that there might be legal liabilities if he doesn't handle the situation properly. So therefore, he must be very aware of what he needs to do. The person also can refuse to accept your help, and a conscious adult or older child can agree or make no objection to your help, but you need to obviously take cognizance of that. Unconscious obviously cannot say no. You obviously have to help someone who's unconscious, and therefore that's implied consent. In other words, that means that if a person refuses to help, you can still stay with them, keep a close eye on the condition until the emergency services come. But if he becomes unconscious and his life becomes endangered, stops breathing, serious unconsciousness coming in and out, you can help even though he said no. Alright, so we have looked at some of the injuries and illnesses in the first week, but we're going to do a little bit more detail now in terms of some of the conditions and illnesses that you have. Let's start off with bone injuries and fractures. Well, first of all, the body consists of over 200 bones, all different shapes and sizes, and all these bones, in addition to all the muscles and the tendons and the ligaments that put them together, form the skeleton. And of course, it goes without saying that's protecting our important organs, and so that they function normally. Now, of course, bones are dense and they're strong, but they do break, especially in older people or people that have got weaker bone structures. Also, people with conditions such as osteoporosis, and sometimes this causes the bones to weaken quite a bit. They can break more easily. People can bleed also. So let's now look at the 2 types of injuries that you can get. You can get bone injuries, you get the fractures, and you get the dislocations. We spoke briefly about it last week, but again, fractures again are open and closed. The dislocations again will involve the muscles and the joints. Okay. And as we said, when an open fracture occurs, let's say an arm or a leg twist, you can actually, when you see the bone that can tear through the skin, that is open. And it can cause excessive bleeding, and it can also cause infection. So there are many things with open wounds that need to be dealt with. Now, fractures can also be life-threatening because if an artery is severed, it can also affect breathing, like for example in the chest, and it can also affect huge big bones like the femur, and of course we need to look for these as well. Now, in terms of muscle injuries, now the body has got over 600 muscles, and which are soft tissue. Injuries to the brain, the spinal cord and nerves can actually affect the person's muscle control. So when a muscle is injured, a nearby muscle may take over the injured one. Now, the joint is formed where the 2 ends or more bones come together in one place, and the bones are held together by ligaments, which tear when a joint is forced beyond its normal range of movement. Okay. So obviously that's why people stretch before exercise to avoid this. Dislocation typically is more noticeable than a fracture. Why? Because you can actually see when the bone moves away from the normal position at the joint, and a violent force tears the ligaments that hold the bone in place, and therefore the joint will no longer function. Okay, and you will be able to see either a ridge or a hollow or something obvious when a dislocation occurs. Now the sprain is a tearing of the ligaments. Sprains generally will swell, but they do heal quickly. Pain is minimal compared to other types of injuries, and it can be re-injured more easily if it's been affected before. And of course, for sprains, the most commonplace are the ankles, the knees, wrists, and fingers. Now, strain is stretching and tearing of muscles or tendons. And for example, now lifting a heavy object or working a muscle too hard frequently causes strains, and can involve muscles in your back, neck, and thigh, or back of the lower leg. And these obviously do reoccur, and so you need to be aware of injuries, past injuries that people have had before. Now let's look at burns. A burn is caused by the following: heat, flames, hot grease, boiling water. It's caused by sun, too much suntan, chemicals it can be caused by, or electricity. Now what happens is the burn actually breaks the skin, and we have either loss of fluid if it's more serious, or we just have, or we can have even more serious loss of breathing, difficulty in breathing, and if you have, for example, burn by chemicals, an explosion, or electricity, again you have to obviously call emergency services immediately. And remember, burns continue going, so therefore you need to do localized treatment to stop further progression of burns. Alright, sudden illness. What are the most common ones? Heart attack, shock, there's stomach ailments, flu, asthma, allergic conditions. And how do we know that a illness has suddenly occurred? Well, number one, with all the symptoms as before, we have swelling, sweating, paleness, nausea, vomiting. All those you just tell the learners about. And when you call emergency services, if the victim has lost consciousness, if they are confused, if they lose, if their breathing is difficult, if their pain, chest pain, that doesn't go away, if they got persistent pain in the abdomen, because that could be their organs affected, if they have seizures or severe headache or even slurred speech, it can be something serious. Also, if they might have been poisoned, or injuries again to their neck, back, or head. These are the critical ones, so these take precedence, the head, neck, and spine, and therefore you should always call emergency services if that's affected. Alright, next let's look at shock. Now shock is not just what people might think, just banging yourself, no, or getting a little electrical shock, no. Shock is a life-threatening condition, and it can be caused by severe bleeding, an injury, or sudden illness. What happens is the circulatory system actually fails to carry the oxygenated blood to the body, and the oxygen-starved major organs can't function. This triggers a series of responses. These will produce special signals that you can see, such as the heart must be working well, an adequate amount of blood must be circulating, and the blood vessels must be intact and must be able to adjust the blood flow. Alright, so these of course will be affected if there's shock, because again this affects the oxygenated blood in the system, the heart, the circulation, and the blood vessels. When a severe injury or illness occurs, then the body will send blood to the vital organs like the brain, the heart, and the lungs. When the tissues of the arms and the legs begin to die, then the body sends blood to them and away from the vital organs. So the victim gets unconscious as the brain's affected, the heart slows and stops as the heart is affected, and then breathing stops as well, and therefore this is why shock is so serious, and a person in shock will die. Let's look at fainting or diabetic emergency. When the insulin level, we're talking now diabetic emergency, is too low, the blood level is too high. And this condition is called hyperglycemia. If this condition is not affected, is not corrected, then the person can go into a diabetic coma. Now, if the insulin level is too high and the blood sugar is too low, then the resulting condition is called hypoglycemia. All right, so that's what how you will determine the type of glycemia. Right, now let's look at providing the appropriate first aid. In the event of emergencies, you need to carry out the correct and appropriate care to patients according to their condition and according to the situation. So let's look at breathing problems, rescuing someone who has breathing problems. A person can stop breathing for many reasons. We've said there could be sudden illnesses. We've looked at what those are. Allergies, serious accidents. If a person is not breathing but has a pulse, then you must perform rescue breathing, which is in fact breathing for an unconscious person. When a person stops breathing, there's only a few minutes that can pass before there's brain damage and death. In a child, the time frame is even shorter. In fact, you can give an unconscious, not breathing child rescue breaths for a minute before you even call emergency services. You stop giving emergency breaths if the victim begins to breathe on their own, if they have no pulse and it begins. Then if the victim has no pulse, then you can begin CPR immediately, and a more advanced medical personnel will take over, especially if you are too exhausted to continue. All right. So obviously when the emergency personnel come, they will take over from you, and obviously CPR has to begin if there's no pulse. Then the rescue breaths on its own will not help. So let's now look at how to do rescue breaths. If a person is not breathing and has a pulse, then the rescue breathing is as follows. You put the head tilt. You can look in the diagram in your notes, and this will keep the airway open. You then pinch the nose gently using your thumb and your index finger, and then you place your mouth over the victim's mouth, making a seal. Again, there are special things that you can use to cover in case of you don't want to get blood on you, etc. To protect you. You can put that on as well. And that is called mouth-to-mouth ventilation. Then what you do is you breathe slowly, watching to see the chest rise, and you pause in between the breaths to let the airflow out. You look for the chest going out and then in. If you notice that the chest is not rising or falling, then you tilt the head back and you try again. If the air is still not going in, then there's an obstructed airway. And what you then do is you do abdominal thrusts. So after giving 2 breaths, check for a pulse. If the victim has a pulse but still not breathing, then you will continue with the rescue breathing. What you then do is you give 1 breath every 5 seconds, and you count the seconds as 1 1000, 2 1000, etc. Taking a breath on 4 1000 and breathing into the victim on 5 1000. Okay, so that's how you do it, once every 5 seconds. You check for the pulse after a minute of rescue breathing. which is about 12 breaths. And if they do have a pulse and still not breathing, then you continue and checking every minute. If the victim's pulse stops, then you begin CPR. So you do the rescue breaths unless the pulse has stopped. That's when you do the CPR, and that is when you try and get the heart to start again as well. Now with infants, as we said, more serious, you need to do that because they have a shorter time required before they die. Again, you open the airway of the infant as far back as you can. That's not going to, obviously not like the adult. Give a child one slow breath every 3 seconds. And on an infant, make a seal over both the infant's mouth and nose. And after 1 minute of rescue breaths, which is about 20 breaths, you then check for the pulse. Now, if there's a pulse and still not breathing, then you continue rescue breathing and checking the pulse. If the breaths do not go in, then you need to retilt and try again because it could be a blockage in the throat. And if the breaths still don't go in, then you might have to do abdominal thrusts, which of course would then help get the obstructed item out so that the air would be able to go in. And if the victim's pulse stops, then CPR is started. So let's now look at checking for a pulse, because again, if there's no pulse, we know that there's CPR. What we do then is, there are three ways in which you can measure it properly. The one is the carotid pulse, which is checked on the side of the neck and felt to the fingertips between the large muscle and the windpipe. The radical pulse, which is checked on the palm side of the wrist under the thumb. Okay? And the brachial pulse, which is the most reliable and most easily found in infants, located in the inside of the upper arm. Okay, that's in infants. Never use the thumb to feel for a pulse because the thumb has got a pulse of its own. And don't feel or compress the carotid arteries at the same time, because this could affect blood to the brain. And this could also cause severe damage. We're going to now look at CPR. Okay. Now, this is applied to a person who's not only stopped breathing, but also his heart has stopped. There's no pulse rate. And this is a combination of rescue breaths and artificial circulation created by chest compressions. Rescue breathing provides the oxygen to the lungs and artificial circulation, which holds blood to flow from the heart to the lungs, where it picks up oxygen to be carried to the vital organs which sustain life. And the motions are used on children and in adults as follows. If the adults are regarded as 8 years and older, children are 1 to 8, and infants are less than 1 year. So depending on if they're an adult, a child, or an infant will depend on the type of CPR that's done. Let's look at the adult first. The chest compression for an adult is 15 chest maneuvers for 2 breaths. So chest compression is applied by placing the hands over one another, locking the elbows, and letting your body weight apply pressure through the heels of your hands to suppress the chest 4 to 5 centimeters. Look at the diagram and you'll be able to see the diagram more clearly how to do it. Step 1. You tap or gently shake the shoulders on this unconscious person. Ask them, are you okay? If there's no response, you then assess their breathing. Put your ear to the mouth, listen for chest expansion, look, feel, see if there's any sign at all of breathing. If there's no breathing, then you call out for help. You shout to anyone to attract attention, etc., so that they can then obviously call to the attention of bystanders, who some of them might be able to assist you if they have medical training. Then position the casualty on the back on a firm, flat surface, supporting the head and the neck. You then open the airway, making sure that the chin is tilted properly. You then reassess the breathing to see if there's any air movement. You then assess the pulse. That's after you ventilated the lungs, obviously doing the rescue breaths. And then you send for help if there is a pulse. If there's no pulse, then you continue to do CPR, where you will then begin chest compressions. And remember to put the hand in the correct position, locking the elbows, bringing your shoulders directly over the sternum, and pressing down to compress to about 4 or 5 centimeters. This should take about less than a second. You need to repeat the compressions at a rate of about 80 to 100 per minute for a total of 15 compressions. Okay, so it's quite quick. This shouldn't take more than 9 to 11 seconds, and you're counting 1,000, 2, 1,000, 3, 1,000 like that, just to keep the rhythm. You ventilate the lungs twice, and then you perform 4 full cycles of 15 compressions and 2 ventilations, which take about a minute. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then you breathe. Okay. So you continue to use CPR until emergency arrives, or until the patient has regained their breathing and pulse rate. Okay. Children is different. Here, as you know, a children's chest is smaller, there's less volume, the compressions are therefore also, because the chest is smaller, there's less, you don't have to go down to such a depth, only about 2.5 to 3.5 centimeters. And the same things are then looked at: assessing responsiveness, are you okay, assess the breathing, calling out for help, positioning them in the proper place, opening the airway, assessing the breathing, and then ventilating the lungs, assessing is there a pulse. If there's no pulse, then send for help immediately, and then finally chest compressions and CPR if there's no pulse. Once you've done that, you reassess the pulse rate. If the pulse rate comes back, then you carry on then with the breathing, rescue breathing, ventilating the lungs. And if the pulse rate goes, again, you continue with CPR. An infant, again, is even smaller, therefore you only use 2 fingers, and you only go to like 1.5 to 2.5 centimeters. And you do the same thing as before. You assess their consciousness, assess their breathing, calling out for help, etc. Exactly the same. But when you do the chest compressions, the place that you put your 2 fingertips along the length of the sternum, 1 finger below the line between the infant's nipples. You compress it again, only 1.5 to 2.5 centimeters, and you release the pressure to allow the chest to return to the normal shape. But you keep the fingers in place. All right, you give 5 compressions at a rate of 100 to 120 per minute. That's very quick. 1, 2, 3, 4, 5. Take about 3 seconds, counting at a constant speed like that. Ventilate the lungs, and you complete 10 compressions in a ratio of 5 to 1, taking about 45 seconds. So each one has got its own way of doing it. If you're an infant, a youngster, or an adult. Okay, so that is the end of the week 2 of first aid.